Welcome back, everybody. This Week in America. Great to have you with us on the program today. Website thisweekinamerica.us. In the book, 52 Years Living with Diabetes in Spite of the Medical Profession, our guest on today's This Week in America, James Zajac, details the arduous road from his diagnosis with diabetes at age 13 to his current successful, albeit unconventional, management of the disease at age 65. The book really offers an enlightening window into the life of a diabetic, his lifelong mission to encourage the American public to take their health care into their own hands. He's a Connecticut native who has lived in Pennsylvania for over 40 years. He lives with his wife and he enjoys gardening, bike riding, swimming, horseback riding, kayaking, and skiing. His website is very simple, James Zajac, and that's ZAJAC books.com. And, of course, link on to our website, thisweekinamerica.us, and get all the information. Link on directly to James' website. James, welcome to the program. It's great to have you with us. Thank you for joining us.
Well, thank you for having me.
It is our pleasure. This is really a major national problem. You've got like $100 billion a year, you point out in the book, that it costs the United States in treating diabetes and diabetics every year. Let's go back and talk about the early days when you were diagnosed. This was back, in the fall of 1958. 12 years old at the time. You weren't really diagnosed yet with diabetes, but you were going to the doctor, and you even sensed at an early age the medical community really wasn't giving you the answers that you wanted. Talk a little bit about going back to that period and your health issues at the time.
Well, all they did was put me on a insulin, which was called Illatin, which isn't produced anymore. It's been replaced by N-insulin or NPH insulin and regular insulins. I believe they had to have had regular insulin back then, but they never put me on a regular insulin. All they did was put me on the Illatin. And the trouble is they never, ever told me anything about the insulin. It's just, here, take this insulin, this many units a day. And, they don't enlighten you about anything.
Well, it's interesting. I mentioned you are 12 at the time, almost 13. You're in the hospital with rheumatic fever. They thought you had strep throat, developed a heart murmur, and you say in the book that they've convinced your mother that they're treating you basically with strep throat, and you're going, this really isn't what I have. So you even knew at that time that they really were misdiagnosed and mistreating you.
Yes. The thing is I don't know how much they link strep throat to rheumatic heart disease. Now, why they do that, I don't know all of the ins and outs about that. But the trouble is I never had a strep throat. Now, I could have had a strep infection. I don't know. Maybe I did. But anyways, I never had strep throat. And all they would do is try to convince us that I had a strep throat, and that's what gave me the rheumatic heart disease. And then the trouble is what they did was they put me on penicillin to prevent another strep infection. Well, first off, if it's like... if you get something once, you're going to get it again, is their attitude. So we got to give you these drugs to prevent it. And the thing is, with the medical profession, it's like all they try to do is find some way to pump pharmaceuticals into you, whether or not you need them or not. And as far as I was concerned, I didn't need the penicillin.
We forget how people got treated back in 1958. You were, basically sent to bed for 3 months?
Yeah, I was on my back. I stayed in bed for, I don't know, it was 3, 4, I don't know, may have even been longer than that. But anyways, by the time I was able to start getting out of bed, where they said I could start getting up and start getting some light exercise, I had diabetes.
Well, it was diagnosed at age 13. Our guest on the program is James Zajac. That's ZAJAC. His website, jameszajacbooks.com. Information available, and you can link on directly at our website, thisweekinamerica.us. The name of the book is 52 Years Living with Diabetes in Spite of the Medical Profession. So you're 13, you're diagnosed. You really have no trust in the local doctor. You end up at Boston Children's Hospital. And you would think there they would have a lot of the answers. They would have people that would be understanding, that would listen to what you're saying, what the symptoms are, and be able to treat those. And you said you really couldn't get any answer there as well.
No, they didn't really have any answers. All they did was keep me on the Illatin, never bothered to explain to me anything about the insulin. See, insulin's peak at a certain time during the day. They start off slow and gradually build up, and that's the way long-term insulins work. Now, at that point, as far as I'm concerned, way back then, they should have had me on regular insulin also, but they never put me on regular insulin. All they did was just put me on the Illatin. It's like they never really understood the disease and never really understood how to treat it.
And you sort of went through, a period of rebellion at that point. You were giving phony test results. You weren't doing the test as they required?
Yes.
Yeah, what were the results? In fact, you're saying there was a big mistake doing that. Talk about what was going through your mind. Because at age 14, you're thinking, I've really had it with these doctors because I don't believe they're doing the best thing for me.
Yeah, well, they would never give me any answers to any of my questions. See, one thing that I've always had was when I became diabetic, I developed these lumps behind my ears. And they were big. I wanted to know what caused them. I never got any answers for it. It was usually just ignored. And the thing is in later age now, I can link the lumps to my diabetes, because when they expand, I have problems with my diabetes. When they return back to where they're quite small, I don't have any problems with my diabetes. I ask about this, I never get any answers. And back then with the Illatin insulin, they just never, ever gave me any idea of how the insulin worked. I mean, there was times when it had to have been stronger, but I didn't know. I just, it's just take the insulin and that's it. And they don't ever give you any explanations about anything. Anyways, they didn't back then, and as far as I'm concerned, they still don't today.
There's a period during this, you're 14 and, like I say, you're rebellious and you've really turned your back on the medical community. A few years later, I think it was like around 1969, you meet a doctor who was a forward-thinking doctor, the only one you mentioned by name in the book, the only one that you said was really ever able to help me. But during that period there, from the time that you're 14 and really concerned and feeling this isn't working what they're trying to do, and when you meet Dr. Alexander, what were you doing for treatment during that period? Was this something you did on your own?
Yeah, I was just taking my insulin. When I felt I needed to take more, I'd increase my dosage and take more in order to try to keep my glucose low. The higher glucose is, of course, the worse, the bigger problems you have. And when my glucose would get very high, I'd feel sick, and I would be sick. So the lower I'd keep it, the better I would feel. But the trouble is there had to have been easier ways to maintain, to check your urine sugar levels. And back then, that was all you had was urine sugar level. That's all you had to check your urine to find out how much sugar you were spilling in your urine. And that's what they wanted me always to do, was to spill a little sugar in my urine. They didn't want me running 2%, and they didn't want me running negatives. But the trouble is just running a trace all the time, because that's basically all 1% is, and it would test 0.5%, 0%, 0.5%, 1%, and 2%. And to keep it between the 2% and the negative readings, it was like walking a tightrope. You just couldn't do it. You either had to be one or the other, and being in between, it was just, for me, it was astronomically hard.
And the cost is something that's interesting. Our guest on the program is James Zajac, Z-A-J-A-C, website jameszajac.books.com. The book is 52 Years Living with Diabetes in Spite of the Medical Profession. You didn't want to be bothered with insurance. In fact, you make the case in the book from a number standpoint that basically your best friend during this period in terms of getting the treatment procedures that you needed, getting the equipment that you needed, was Walmart.
Yes, that's who I go to all the time to buy everything that I need. And I don't go through the insurance. Everything that I get from Walmart was like about $5 more or $2 more than what I would have had to the insurance company would pay. I mean, the insurance company pays a certain amount, and then you have to co-pay. And the copay for the blood glucose monitoring strips was $35 is what my copay was. And for my insulin, it was always a $20 copay. Well, now I go to Walmart, I get it for $25. That's $5 over what my copay is. And the test strips, I pay something like $38, I think, for 100 of them. That's $3 over what my copay would be, because I would get punished for if I used more than 100 in a month, I'd get punished by the insurance company where my copay would be up to $35 rather than the $20. And me, I'm more interested in knowing what my diabetes is doing rather than worry about keeping my copay down to $20 or $35.
Well, that's interesting because one of the battles you had was getting your medical records. And you say it's important that you get the medical records first. They're your medical records. They're not your doctor's medical records. They are yours. You fought with the legislature in Pennsylvania to do this. Talk about the importance of that. In fact, the whole basis of the book, 52 Years Living with Diabetes in Spite of the Medical Profession, is it's your diabetes. It is your diabetes alone. It's not your doctor's. Talk about the importance of getting the test results first and being able to understand what they're telling you.
Well, a lot of times doctors overlook results on your tests, and I mean the thing is if you have any kind of problems, you're going to be able to see them on your test results yourself. You don't need your doctor to tell you what problems you have. I mean, you can look at it and tell yourself. And the thing is what I had doctors refuse to give me test results, the test reports, where I had to threaten them and get abusive in their waiting room in order to get those test results from them. I got sick of putting up with that. And it's important that people see their test results and know what's going on. And then by knowing what's going on, you can ask the doctor questions when you make an appointment to go see them. And you don't have to wait for them to call you over the phone and tell you everything's fine, when everything might not be fine because they've overlooked certain things on your test report. And like I stated on one incident where my triglycerides were low. As far as they were concerned, the lower the better. I could have 0 triglycerides and it would be fine. Well, it's not true. And when I went to the library and looked up what the test result, the test was, and what the results were and where they should be, it stated a problem with a particular disease called lipoproteinemia. And, it's a degenerative disease if you let it persist. And they would have never treated it. They would have been treating the other problems that would have arose later. So, I mean, the thing is people need to take a look at those test results and analyze them themselves. And then that way they have what the information to know what kind of questions they need to be asking their doctor when they go see them, and not leave the total responsibility up to them.
Time going by too quickly. A few minutes left in the program. The book is called 52 Years Living with Diabetes in Spite of the Medical Profession. James Zajac, our guest in the program, Zajac, his website, jameszajacbooks.com. You can link onto our website, thisweekinamerica.us, and get there and get all the information. You're talking the book, you've had like about 20 doctors, and you really considered you didn't have a regular doctor during this period. You meet Dr. J. Deaver Alexander, and you did, in fact, you dedicate the book to him. What was different about him and the relationship you had with him?
Oh, I could have a conversation with him. And one thing is when he left the room to go see the nurse about something or for whatever reason, they never bothered to pick up my medical records. He left them right there. And sometimes I'd be looking at him when I came back in, and he would say something to me. He says, "You find anything interesting in there?" And I said, "No, not yet." I says, "Most other doctors get annoyed when you want to look at your test records." And he said, "They're your test records. They aren't mine. You're welcome to read them anytime you want." That was his attitude, and the thing is he was a person that I could talk to, and there were times when I was in his office that we had conversations that had nothing to do with diabetes. Me, as far as I'm concerned, if you can't talk to your doctor, go find another one, because all he's interested in is having you come in there and shovel money from your pocket into his.
In fact, you refer to doctor as an advisor. Again, going back to my diabetes is my diabetes. You're going them for advice. You are the one in control of how you're going to treat it. The book is 52 Years Living with Diabetes in Spite of the Medical Profession. Something I know that I mentioned your battle with Pennsylvania and the legislature to get your records. You're concerned about the medical profession now and how they're forcing, even taking young people to court to get them to use the conventional treatment, a case in Massachusetts with a young girl who's fighting having conventional chemotherapy. In just a couple minutes left in the program, talk about your interest in that and why you feel that's so important, especially for young people, that they're not taken advantage of, and they do have some say in how they're being treated.
Well, chemotherapy I have no use for. As far as I'm concerned, most people would be better off not taking any treatment at all and just rejecting the chemotherapy, because the same result is going to happen. They're going to die anyway. And all chemotherapy does, as far as I'm concerned, it'll shrink the tumor, but it usually only shrinks it temporarily. There's only about 4 cancers that can be treated with chemotherapy, and all of the rest they aren't treated well with chemotherapy. And the end result is death. And the thing is people, there are... one person that I describe in my book, the one about the girl in Massachusetts, she's just recent. She's going to the Supreme Court to prevent the hospital from forcing chemotherapy on her. But someone else was, back when I wrote the book, was in the same situation where they were taken to court by the hospital, and then they had to accept chemotherapy. I mean, that completely takes the control of you out of your hands and your parents' hands on the treatment for you. Now, none of these people have refused all kinds of treatment. They just wish to do natural treatment rather than the chemotherapy.
And in the book, you talk a lot about natural treatment. You talk about a guest we've had on this program, Susie Cohen, and you encourage people to read everything they can. The book is 52 Years Living with Diabetes in Spite of the Medical Profession. I'm going to take a minute here at the end of the program. Tell me how you're doing today, and when you look back, especially when you're writing the book and you reflect on the 52 years, if you would have done anything differently. First of all, how are you doing today?
I'm doing fine today. I have no diabetic complications. I have all my toes. I have my eyesight. I don't wear any corrective lenses. I do wear contact lenses, but most of the time I don't bother to put them in because they're just a pain in the neck anyway, and my eyesight isn't that bad where I need to have them in. I have none. Like I said, I have no diabetic complications. And the only thing that I would have done differently in my history as a diabetic is I would have never put myself on Humalog insulin. I think Humalog insulin is the worst insulin any diabetic can take. What it does is it promotes gluconeogenesis, which is your liver secretes an enzyme that causes your body to break down muscle and turn it into glucose. You don't need your body doing that. All it does is increase the amount of insulin you need, and it's detrimental to you. And as far as I'm concerned, right now what I take is NPH insulin and regular insulin, and I don't bother with any of the engineered insulins.
It's a fascinating book, 52 Years Living with Diabetes in Spite of the Medical Profession. Our guest on the program has been James Zajac. That's Z-A-J-A-C. The website is jameszajacbooks.com. And, of course, you can go to our website, thisweekinamerica.us, and link on directly to James's website, get information on how to contact James, how to get information on the book as well. James, it's a fascinating story. It's going to be very helpful to people who are out there going through similar situations to what you went through back when you were a teenager into adulthood. Thank you for sharing the program, sharing the story with us on the program. It's been great to have you with us.
Okay, thank you for having me.
It's our pleasure. You're listening to This Week in America, website thisweekinamerica.us.